who do I talk to when I'm not understanding the information? Where do I go when I have a problem? Sometimes you can go in and you not really present yourself quite well, and you don't really know how to explain a particular symptom well, and therefore you leave
that's
feeling,
me.
That's
me.
So, and then again, you're now going to be shortchanged, and you feel like, oh my God, I waited so long for this appointment, but I feel like I didn't really get any value out of it. And sometimes it's just simply because the communication as to what exactly do I need to say. The earlier you pick up something, the earlier that something can be done about it, right?
What are some early signs of anxiety or depression people often ignore?
You're struggling to sleep, so your sleep is affected, or your appetite is affected, might be reduced. You're just starting to feel a bit more fatigued and tired a lot more often. You're not able to sort of concentrate as much. I think the nice thing and the setup that they have here in Ireland is that there's a lot of family resource centers. Right?
Yeah.
So that would be the first point of call. Your balance has gone off, or you're starting to have, the E is for eye changes. So you have change in your vision. The vision, maybe you might feel as if it's a bit blurry, or you might feel as if part of, the field, social connections are very much crucial for your well-being. Do not isolate yourself. And I think that's what we sometimes do as migrants as well.
What lifestyle changes can reduce the risk of stroke? Welcome to Northwest Podcast, produced by Coco Officials. Each week, we sit down with entrepreneurs, artists, community leaders, change makers, and we talk creativity, culture, and the journey of becoming. So, if you enjoy what we're doing, take just a second to subscribe to our channel. You can also support this podcast by buying us a coffee via the link below, or sponsoring an episode and proudly associating your brand with us. All the links are right below, and don't hesitate to drop us a message if you wish to be one of our guests. So, now let's dive into it. In today's episode, I have the pleasure to be sitting with a doctor. Her name is Thobeca Changamire. You're very welcome, doctor.
Thank you for inviting me.
You're very welcome. And for those who don't know you, who is Thobeca?
Okay, so Thobeca Changamire is a medical doctor who is very passionate about the work that she does. I particularly am based in a primary care setting.
Yeah.
And because of that, I have I'm able to meet different types of patients, from children all the way to the elderly patients. And because of that, I have a very, I find that it's an opportunity for me to be able to promote health and have a holistic picture while I'm doing that, right? So this is me. I'm someone who's very passionate about health promotion. But before we even get to that, I am a daughter of a mother who was hardworking. She was a nurse and a public health specialist.
Okay.
So I grew up in that environment, in any case, where I saw her working hard at work, but also was heavily involved in community-based health promotion activities. So I think that's where my passion and the drive comes from, right? My father as well was a scientist as well, and he would also, in his way, also promote education. So he was more of an education specialist. So this is the household that I'm coming from. Two professionals that raised me and gave me the opportunity to become a medical doctor. And I think from what I saw and what I saw them do in the community and how they were able to uplift their community, that's where the initial passion comes from. Yeah. So I guess just me trying to walk into my parents' footsteps.
What is included in health promotion?
Health promotion is about giving people the right information.
Yeah.
Information that they can easily understand as well, to be able, so that people are able to make the right decisions around their health. It's about trying to prevent illness rather than acting when someone is ill.
Yeah.
Right? So the goal of health promotion is more preventive rather than just curative alone, right? We're trying to prevent illness. But in instances where someone falls ill, we're trying to prevent the complications of that illness, right? So you get preventive health interventions to people who do not have a chronic condition, but you can also get preventive health measures to people who do have a chronic condition, but you're trying to prevent complications of that chronic condition. So health promotion is about physical health, it's about mental health, and it's also about social well-being.
Yeah.
And those are the activities around those three main domains. Yeah.
So what motivates you to focus on this domain?
So remember, health it's not just an absence of illness, right?
Yeah.
Health is a holistic picture that looks at your overall physical well-being. It looks at your mental well-being, and it looks at your social well-being. So there's three main domains that we talk about when we're talking about health. So it's impossible to achieve overall health by just focusing on one. Right?
Okay.
So if I focus just on physical health and I continue just to talk about physical health, but I'm not talking about mental health and I'm not addressing social health as well, then I'm not being a good health promoter. So you will find that this is why on my social pages, I am passionate about stroke health. I am passionate about talking about mental health.
Okay.
And then I also try to organize events, mainly based on connecting people, because an understanding that is there is that social connections are vital for well-being. The goal is to fight loneliness, right? Because loneliness itself is highly linked to mental illnesses and also physical illnesses as well. So all the activities will center around trying to promote health, trying to promote mental well-being, and also trying to fight loneliness through social connections. So that's what you'll find when you go to my social pages. Those are the main things that I will be talking about.
That's very interesting. So what makes your approach to health promotion different from a medical consultation?
So remember, a medical consultation, you're mainly trying to address a problem, right? That someone comes to you with, right? You are trying to diagnose a problem and you're going to be trying to figure out a treatment plan for that person. On top of the treatment plan is always going to be probably an opportunity that you have identified factors around their problem that they might be engaging in their day-to-day lifestyle or their habits, for instance, that are affecting and causing them to have that problem, right? So during a medical consultation, I'm going to be diagnosing something and I'm going to be giving you treatment. But my job doesn't stop there. I have to now try and equip you with skills that are going to help prevent you from coming back again, or that are going to help you manage the condition better. And sometimes when you're sitting there, as you would know, the medical consultations are not long enough, right? So they're not long enough to address the actual problem. And probably someone has been waiting for maybe weeks for that appointment. And maybe by the time they do come to you, they've got a number of things or ailments that they want to talk to you about. And so by the time, you know, you're sort of done with that, you realize that, man, there's a couple of issues that I wanted to discuss, but I didn't get the opportunity. You know, this is now me trying to now make other ways of engaging with people to talk about their health, just apart from the time that they come to me when they actually do have a problem. I'm trying to give them more information that I wish I could have said during that consultation, but maybe just didn't get the time, you know. So I think my approach is, you know, just trying to be more, give people a lot more information to help them become more confident navigating their health, right? So it's about the confidence about navigating your health. And sometimes when you're sick, and at that time, it might not necessarily be the right time to talk about other things that are contributing to your lifestyle in general, right? You're coming, you've got a problem, you want to get that sorted. That's the main priority. And then now when I start talking about other things, you're probably not going to retain as much information. So the goal is not just for you to hear what I'm saying. The goal is for you to be able to retain and then to apply that information. And I feel there's other spaces that we can do that apart from a consultation room, and that's in the community. Yeah, and there's different ways to do that. So that's where I started the social media channel.
All right.
And from that channel is where I just give small snippets of information. Again, not wanting to overload you with information, right? So I try to make them quite short. So that's the social media channel with videos. And I feel through the years of experience of working, you get to realize maybe certain stories that keep replaying, that bring people back into hospital, certain risky behaviors that keep replaying, that bring people into hospital. So I try to create a story. So you will find that some of the videos that are on the page are a story. It's a story that I keep seeing. And it can maybe just be a reel, like a 10-second reel with pictures. And I'm just trying to highlight a story. So it's learning through stories. And I feel if we do it that way, so it's trying to deliver the health message in a different way. Instead of saying, these are the risk factors for diabetes, I am trying to depict a story from that. And then you will decipher from that story that this is a risk factor for diabetes. So that's how I think I'm trying to deliver the messages a bit different, is mainly I'm doing it through storytelling. Yeah. And I think maybe that, I hope, is more engaging.
I think that should be more engaging. That should be the best way to engage with people also.
Yeah. So
what do you find most rewarding about this work?
What's rewarding is because I'm doing it more largely through social media. Is it's hard to get people captured, should I say, especially with health messages. It's not really attractive, it's not fascinating. But when a question comes in from a comment, that is rewarding for me. Because what I have said in my motto is, it's going to be health promotion through one conversation at a time, through one post at a time, through one video at a time. So if I get a like, for me, that is rewarding. If I get someone making a query, for me, that is rewarding. I had a reel one day and I posted just a video of a lady who had a blood pressure machine, and she was recording the blood pressure machine, her blood pressure from that. And there was a comment that just came through and they said, I'm very afraid to get checked. And I was then able to just inbox them and we had a chat. And, we were able to address why they're afraid to go in and have their blood pressure checked. So it's simple things like that, that when and I do not know where this person is. That's the other thing, that I enjoy doing it on social media, because you want to reach out to a larger group of people. And that's the point of health promotion. It's different from clinical medicine. With clinical medicine, you're dealing with the patients that you're seeing at that particular time. With health promotion, you have an opportunity to intervene to a larger number of people. And I think that's where the impact is most felt. So from a community setting. So we're going to go deeper in that later. But if someone asks why health promotion is important today, what do you say? Why health promotion is important today, I think we can think about, for instance, the COVID pandemic, right? And I think that's when we really saw the importance of just trying to always strive for overall health. It was because people with chronic conditions unfortunately succumbed to COVID, or had sort of longer lasting effects of COVID. So we're also seeing a higher, so apart from pandemics, we're also seeing an increase in the number of lifestyle related conditions. And what I talk about mostly on the page is stroke, right? And stroke, majority of the risk factors, about 80% of the risk factors, are related to lifestyle related conditions. So if we try to address that, then we're going to reduce the number of stroke. And stroke is one of the leading causes of death and disability globally. So,
Okay, what are the most common health challenges do you see in the community today?
the common health challenges that I see are mainly not necessarily, so it depends with the context.
The context,
right?
yeah.
The context. So as someone who would have likely practiced in an African setting, I think the common health challenges would be barriers to access to health. Access meaning access to information, right? I don't think we have enough information dissemination activities that go on that really give people enough information and confidence to be able to make the right choices.
Yeah.
We don't have enough screening activities as well in high risk populations. So I feel there's more room for that to be done. It is there, but there's more room for more of such activity to be done. So in an African setting, I would talk about access, even access to the actual healthcare service provider, and we'll have things like cost, right? Or even fear of approaching, a clinic. For instance, I was once living in South Africa and went at a very early on stage in my career.
Yeah.
And at the time I was joining my husband, and I was not working at the time. And I had just delivered my baby back in Zimbabwe and relocated to join my husband in South Africa. And fear of, I needed to get a family planning solution, but you would see negative messages on social media, about the clinic and everything. And for a while that really did deter me from going. But me being a health professional, I knew I had a human right to access health, and that gave me strength to continue on and proceed with my clinic visit. But for a long time, I was very fearful of approaching the clinic. And thank God I did approach the clinic, and I met a very lovely lady, and she assisted me very well. So things like that is that there's a lot of barriers to health for various reasons, either cost or either just fear of the health system. But if you give people enough information, and give people confidence and trust, they will be able to, access the health services. So that's the challenges that I would mention maybe in an African setting. And then maybe in here, I think it would be more about information is there. Maybe sometimes it would be about understanding the information, right?
Yeah.
So we can have access to the websites that give us enough information, but am I understanding that information? And who do I talk to when I'm not understanding the information? Or there's a lot of services around, but just a lack of knowledge of where do I go when I have a problem.
Yeah.
Those are the things. So those are the things that I'll be addressing depending on the context or the audience that I'm talking to. So if I feel like this is a post that's more related to where I'm currently at, I will be talking more about signposting people that if you need this, this is where you need to go. Or if you see something like this, this is what is. So I'm explaining conditions, or I'm signposting. But then to a different certain population, it's more about access and just making free access. So which is why you will find that on some days I do give free health chats. So they are not medical consultations, but it's the issues that I'm talking about. The just trying to give you the confidence that you need to navigate your health, or giving you the right skills or the right conversation tips for when you go in to see your doctor. What do you ideally need to say for that, consultation to be fruitful, right?
Yeah.
Sometimes you can go in and you not really present yourself quite well, and you don't really know how to explain a particular symptom well, and therefore you leave feeling,
That's me.
So, and then again, you're now going to be shortchanged, and you feel like, oh my God, I waited so long for this appointment, but I feel like I didn't really get any value out of it. And sometimes it's just simply because the communication as to what exactly do I need to say. So it's things like that I guide you during those telehealth conversations. Or for instance, if you've got a diagnosis and you just want to get better understanding around that diagnosis, I'll talk to you and explain what it is, and to make you understand, so that you can be, I think if you do have a diagnosis, the most important thing is for you to understand what it is. That will make you understand, what am I supposed to eat? What should I not eat? How am I supposed to take my medications, and why should I take the medications in the first place? And also understand the consequences of not adhering to the advice that the doctor has given. So it's things like that I clarify things better for you. So that's the stance that I've taken. I think maybe people would assume that I'm more clinical and it's care. or medical consultation, but I feel that there's a lot more to be done to help people get clarity around
Get
their health.
clarity.
So my stance is helping you get clarity,
Get the right information.
the right information
Yeah.
around your health. Yeah.
How much does lifestyle, I mean, diet, sleep, stress, exercise, influence of our health?
Largely, it does. It does all of that. So the lifestyle. So like I'm talking about that, and they are all interconnected. And which is why when I talk about stroke, you will find that it doesn't just touch on stroke alone. There are risk factors around stroke, and these would be the same risk factors that would cause heart diseases as well. So when I talk about diabetes, when we talk about cholesterol, when we talk about excess weight, when we talk about smoking, when we talk about alcohol, all these increase your risk of stroke, right? But they also similarly do also increase your risk of heart diseases.
Yeah.
Right. So that's the lifestyle we're talking about. Sleep as well will also increase your risk of stress. Stress, then again, leading into you increasing your risk of mental health challenges. And remember, when you are struggling with mental health, it affects the way you think, the way you feel, the way you behave. Right. So your choices around certain things might be a bit impaired. So you're more likely, probably, depending on the type of mental health disorder, you're more likely going to engage in probably, let's say, substance abuse, which again now increases your risk of, lifestyle-related conditions that we were talking about, diabetes, hypertension, and then again, that will then increase your risk of stroke and heart disease. So they are all interconnected. Yeah.
So do you think people pay enough attention to prevention, or mostly focus on treatment?
It depends where you are. And again, it's not because, I think sometimes it's not because of choice, right? It's not because of choice. So you might not have access to the financial means to go for screening, right? And therefore, even when you then fall ill, you're only going to go in and get help if you're going to be able to afford for it, right? So it depends with your setting. Again, context. Ideally, people might know that they need to focus more on preventive health, but they don't have the means to do that in countries where everything is somewhat privatized, right? But here there are programs that are there, there are screening programs that are there, and sometimes it's just the lack of knowledge of these things. But I would say not majority of people focus just on the curative part of their health. I think here people do focus on preventive health if they have the access. Again, it goes back to, because even here as well, you do have people that are private patients, right? Going back again to the financial, situation that we're talking about, that it's always about the finances. Can I afford to go in and have my check? Can I get an appointment? Is this time, am I available during that time? So remember, we have people that are working at different times, and we're open probably from 9 to 5. There are people that are always working and are free in the evenings. Do we have services available for people who want to get screening and preventive health done on them after hours? So it's not necessarily always going to be just by choice, but sometimes people do not actually have a choice to seek preventive health measures.
Best the best option is to go for prevention.
Yes. The best way is to always go prevention when we talk about strokes, when we talk about high blood pressure, when we talk about diabetes, because the earlier you pick up something, the earlier that something can be done about it, right? That's the goal of preventive health. So it's to prevent progression of that problem. And it's the same with screening for cancers, right? So the earlier you go for screening, the earlier something is detected, and ideally it's detected at a stage where something can be done about that problem. So preventive health is always the goal. I think the goal in life overall, I think, is to live the best life that you can live comfortably in your physique, and enjoy that life, right? So that's the goal. So the earlier something can be caught, the earlier then something can be done about that, and to keep you as healthy as you can be. Yeah.
So why do you think is important? For instance, me, I'm not sick, but why do you think it's important for me to go to hospital and check myself, check my health? Do you think is it important, and why?
It's important. So you'd be going to.
But I'm not sick. I'm not sick.
You're not sick?
Yeah.
So you are not sick. Remember, we said health is not just the absence of an illness.
Okay.
That's the first thing.
Okay.
So you're not sick.
Yeah.
Doesn't necessarily mean you're healthy. You
Okay.
understand? So we have to make sure, because you don't feel like you're sick doesn't mean you're necessarily healthy. You need to have screening done. You need to have screening done in a primary care setting. The minute you then go into hospital because you're ill, it's a different story altogether. You are ill. So the goal is to go in when you're feeling fine. When you feel like, oh, I'm 100%, is when you just go in just for screening. That's why we're calling it screening. You have no physical symptom. You have no physical complaint. You have no mental health related complaint, but you're going in for a checkup, right? You're going in for a checkup. And then at that point, those would be the good times to talk about, or the appropriate times or the opportune moments to talk about what can be done about your lifestyle to continue keeping you healthy. Yeah.
Don't you think fear plays an important role in that? Because sometimes you are like, I'm not sick. Why am I going to do a checkup? So maybe I'm going to discover something.
That's exactly
so
it.
I prefer to stay at home.
yes, that is there. That is 100% there, and that is understandable. But fear is because you are expecting something, or you might not have good understanding of what can be done about that problem, right? What is it that you're fearful of about that particular problem?
Yeah.
And this is why it's always important to speak to your healthcare provider, your GP or your nurse, your public health nurse, is because you're then going to get good advice, appropriate advice about that particular thing that you're afraid of. And good that you brought that up, because I think there's a lot of information that we are consuming on social media that might not necessarily be reliable information, right? So it's always important that when you have any fear, just be sure who you're talking to. Are they really a healthcare professional? So that you're reassured that it is reliable health information and they're giving you the correct facts. A lot of fear is because probably you've seen something on the internet that has heightened a problem, but no particular health problem is going to be the same between people. We have different backgrounds, we have different genetics, we have different presentations of that, and we have different comorbidities, should I say. So your story is going to be different from someone else's story. Your risks are going to be different from someone else's risks, which is why it's always important that even when you take in information from the internet, your best advice remains the one that you and your doctor or you and your healthcare provider gives you, because they are taking into account what exactly your risk factors are. Yeah.
So we're going to talk about mental health. Why is mental health such a vital part of overall health?
So it's part of that overall health that we were talking about. That we cannot talk about health without talking about the physical, without talking about the mental health as well. So it's part of the overall health. And why is it so important? It's important because it affects how we think and interact with people. It affects how we're able to cope with stress. It affects how we react to certain challenges that we experience in life. It affects our emotions as well. So if we're not aware of where we are from an emotional state, if we're not aware of how we are from being able to cope with stress, then we might not necessarily be able to react appropriately when we're interacting with other people. So mental health is very important on a day-to-day basis. It's dynamic. It changes from a day-to-day basis as well. So it's always important to have self-check-in sessions with yourself. Have a check-in session. How am I doing today? How am I feeling today? So really what I talk about more on my pages there is when we talk about mental health, largely I'm just trying to raise awareness around emotional awareness. You know, sometimes we just don't give ourselves enough time just to check in with ourselves and say, how am I feeling today? There was a reel that I posted. It was a man that I posted, and it was a YouTube video that I posted on the channel there, and it was a man, and he was in tears, and that was one of the reels that performed the most on the channel, and I think people were able to relate to that.
To that, yeah.
You know, it's because I think we haven't really seen men that are in touch with how they feel, or should I say, not necessarily in touch, but who feel they're not able to express or openly show how they feel, which is one of the challenges with mental health, especially more so related to men, that we find that they have a less sort of health-seeking behavior around mental health compared to women.
Yeah.
So you will find that even with the statistics that you will find that more women would be diagnosed with depression and anxiety. But when we're now looking at the suicide rates are higher in men. And it's because of the health-seeking behavior around mental health in men. Yeah.
What are some early signs of anxiety or depression people often ignore?
So, and it presents differently sometimes between men and women, but commonly, you know, the early signs would be you're struggling to sleep, you know, so your sleep is affected, or your appetite is affected, might be reduced. You're just starting to feel a bit more fatigued and tired a lot more often. You're not able to sort of concentrate as much, maybe at work or at home. And you're starting to feel, more so with depression, you're now starting to feel feelings of just being hopeless. Feelings like, I can't really get out of this situation, right? Feeling of your self-worth is also reduced with that. You start to always just look at yourself in a negative way. You know, there's nothing much that I can contribute in society. I'm worthless. So things like that. So it's worthlessness, just hopelessness, fatigue all the time. You're sleeping, you are your appetite is down, and you lose interest. More importantly, you lose interest in the things that you used to enjoy. So if you're someone who used to enjoy playing football, you'll find when you're calling out that friend of yours, man, let's go out. Are you here? No, not, you know, you can see now this is not really what, you know, that's his behavior. So that's the change of behavior. But sometimes might not necessarily always just be typical in that way. You might find increased risky behavior. More so in men now it becomes increased risky behavior, also with increased rates of substance use and abuse, right? So you might see that, that friend of mine is drinking a bit more than they used to, right? So check in with them and find out, you know, what's going on. So those are the main symptoms that you would try to be more aware of, and either pick up for yourself or for those around you. I think sometimes the main thing is, as I was talking about, the social connections are quite crucial to mental health, and we can all play a part in trying to promote mental well-being. We all have that ability to try and promote well-being, you know, so simply reaching out to someone. How are you, man? You know, just hanging out. Social connections is very important for mental health. Reducing loneliness. You know, loneliness is really becoming a problem. We're all starting to live very individualistic lives and just keeping up to ourselves, but that is really increasing the risk of mental illnesses in our lives. So I think we all have that opportunity, just to highlight that we all have the power, we all have the means to try and be there for someone, you know, and try to be more careful in analyzing if there's a change in behavior. I think just to be a bit less judgmental when you see a change in behavior in someone, or if someone is acting out, as we would say, try to find out what's going on, try to signpost them. You might not necessarily be the one to help them directly, but you can say, look, you know, there are centers, family resource centers, where you can get the right information. You can get access to counselors as well. And the earlier, just like high blood pressure, just like diabetes, the earlier you pick up a change in mental health, right? So the earlier you start to pick up these symptoms, a change in behavior, increase in substance use and all that, the earlier you refer someone or signpost them for counseling, the earlier we can prevent progression into an actual mental disorder, So prevention again, that's where we talk about prevention, that when we pick something up quickly, let's try and intervene quickly to try and prevent spiraling down.
So how does that affect physical health too?
So physical health, it's very much linked. So if for instance, if I now have, I'm now close to depression, right? I'm not going to be thinking well and acting well. So even planning, my planning capacity, remember your overall physical health is about you making a conscious decision to plan around doing something. Okay, I'm going to eat this way. I'm going to go out and train this way, or I'm going to do indoor exercises and do it this way. Your energy is low, right? So you are not going to be doing the things that ideally should be done to maintain a healthy lifestyle. So it does definitely then affect your physical health, just apart from you not making the right choices around your diet and exercise, but also the risk of developing or starting out to have risky behavior also increases. Smoking, maybe substance use, maybe illegal substances as well. That might also be seen in certain mental health disorders. So definitely your mental health will affect your physical health. Yeah.
So what practical daily steps can someone take to protect their mental well-being?
Practical daily steps. So practical daily steps would start with, I would say, sleeping, adequate sleep.
Yeah.
Right? We mentioned adequate sleep. Would mention healthy eating as well. Right?
You just mentioned about sleeping. What if you cannot sleep? Like you are overthinking, you have anxiety, and you are overthinking and you can't sleep. Sometimes even it's happened to me even last week. I think I can't sleep. I wake up like 2 o'clock, 2 a.m. and then I can't sleep till the morning. So
like you said, in the words that you were saying, you mentioned stress, you mentioned anxiety.
Yeah.
What have you done about that? Right. So it's to be aware. You're aware of, that I'm stressed. So what are the coping mechanisms that you have around dealing with stress? Okay. Right? And when you say anxiety, it's more related to what are you fearful of? Right? And it's simple measures that we're talking about, that sometimes it might necessarily be, depending on the severity of things, right? You might just, all you need probably to deal with the stress maybe is take a walk. All you need is talk to a friend, but it's to not acknowledge and not do anything about that.
Okay.
So I've acknowledged that I do have stress. Okay. What have I done? What are my probably daily routine measures that I take to de-stress, right? Or am I going to talk to that trustable friend and talk to them, and maybe they help me to deal with my stress? Or if you find that it's becoming a pattern and it's starting to affect my quality of life. So remember, mental disorders present themselves in a way that they start to affect your routine, your life, right? Your day-to-day routine. So when you now see that, no, man, the sleep pattern is really starting to become a continuous thing. I'm no longer performing as much as I was at work. I'm no longer concentrating. That's now starting to become a problem. It's affecting my day-to-day routine. It's affecting my quality of life. Then seek professional help. Speak to a counselor. And sometimes, you might not necessarily know why. Why am I stressed, or what is it that I'm anxious about? You don't have to know exactly why you're going to a counselor. You're going to them and saying, I have a problem, but I can't really identify what is the actual thing. They will talk you through it. And they'll guide you and give you the necessary coping skills.
Yeah.
They will refer you appropriately as well. If they feel this is now beyond our expertise, then they will refer you up as well.
Yeah.
But it's important for you to, you can try self-measures depending on the severity, talk to your friend. But if you find, now my life is starting to get disrupted, then you need to seek professional help. Yeah, you need to seek
I remember
help.
what I personally did last time is I I write all the all I have everything on paper. I wrote them down on paper, and then I burn the paper.
Okay.
So, like in a minute, 2 minutes ago, I felt myself like free.
Yeah. So that's acknowledging what it is that's giving you the problems. You're becoming more aware. So that's what we talk about when we say it's about emotional awareness. It's about awareness of the things that are affecting my life. It's about trying to deal with them, and we all deal with stress and problems in different ways. No particular way is going to work well for everyone. So for you, that was your outlet. In some people, it might be jogging. In some people, it might be a cup of tea. There's different ways of just trying to de-stress, right? So the goal is to check in with yourself on a day-to-day basis. What is it that's giving me stress? And then you try and see what is it that I'm going to incorporate into my day-to-day lifestyle to help me deal with those stresses that do come on a day-to-day basis.
And how can we reduce stigma and encourage more open conversation about mental health?
So stigma, I think it's about acknowledging that things are there. So you can be the one to start conversations around mental health. If it's a group of friends, you can be the one to say, oh, look, I saw this, website, or did you know it's Mental Health Awareness Month this month? Or you can, they even had a band that they have a green band that they were just trying to highlight the mental health awareness. So you can be the one to be initiating conversations around mental health. And the more we talk about it, the more people are going to open up about it, and the less the stigma, right? So it's about having more conversations, whether in the house, whether in a community, in a church, in a school, whether it's at work. But it's just to talk about things more in a positive way again, in a positive way. And that's how we can start to deal with the stigma around mental health.
Now, let's talk about men and mental health, because it's an important issue also. So why do men often find it harder to talk about their mental health?
I think that's more on a generalized basis. It's. I think there's a lot of expectation that men face in society, that they are the providers, they are the backbone of a family. They're expected, societal expectations and norms, that they're supposed to be the strong ones, right? And so when faced with challenges in life, and life does happen, I think it's sometimes they might feel embarrassed, probably, and to acknowledge and to talk about it. And that's why some would then just continue on and try to just hang on and keep going. And, to a point where, that's where that risky behavior might now start to come in, substance abuse, like what we're talking about. And those are when, such behaviors come in. And sometimes to a point, unfortunately, where they don't end up even seeking any professional help, to a point that now leads to suicide. So I think it's the societal norms and expectations that we have placed on men that puts a lot of expectations on them and just puts a lot of pressure on them. I think that's one of them. Probably maybe a misunderstanding as well, and the fear that when they do go in, the stigma, that's the stigma, right? So there's a lot of stigma around mental health in men. Right, so stigma plays a role as well.
So, what are the dangers of men keeping silent about stress or depression?
So, keeping silent to the extremes, it would now be things like suicide, and which is what we're seeing is that globally men have higher suicide rates compared to their female counterparts. So, I think that would be the negative effects of not seeking help, negatives, and that's to the extreme. But you will find things like probably broken relationships, absenteeism at work, violence in the community, violence at home, and the reckless behavior and substance use and uses of illegal drugs as well. So those are all the negative impacts of not dealing with your with the mental health challenges that someone faces on a day-to-day basis.
So what do you think, how can families and friends support a man better in this situation?
I think it goes back to what we were talking about, that, with when we talk about mental health and mental health literacy, right? It's us making conscious decisions to improve our understanding around mental health. So I think we all, as a family, as a community, we all have to make conscious decisions to improve our knowledge around mental health. And while we do that, that's where we now start to have better conversations around mental health. And if we now have conversations around mental health, then the stigma is going to go down, right? And therefore, if someone is to have a problem, they feel free and comfortable to come up and discuss, what it is that they're experiencing. So as a community, it's about having more mental health literacy activities in any setting that you're based in, and having more conversations that will now help to decrease the level of stigma around mental health. And this then gives, people courage to come up and seek help when they are faced with challenges.
So for someone who is struggling with mental health and doesn't know where to begin, what advice could you give him, especially people from migrant community in Ireland or all over the world? Yeah.
I think the nice thing and the setup that they have here in Ireland is that there's a lot of family resource centers. Right?
Yeah.
So that would be the first point of call. Approach your family resource center. The family resource center is a center that will signpost you and give you direction. They've got a wide range of services that are available.
Yeah.
From health to mental health, to physical health, to sporting activities, to social prescribing.
Yeah.
Right. So they have what they call social prescribing as well. And they will be able to signpost you to say, go and speak to this person. Counseling services, services around, even educational literacy, not just health literacy, but just educational literacy, because I think that's also a challenge regarding access to health in any form. If someone has got limited literacy levels, they are very fearful of interacting with people in society, right? But the Family Resource Center also has services and they'll be able to direct you as to where you can go and how they can help you as well around literacy. So that would be the first point of call. The Family Resource Center.
So can you list some of these Family Resources Center?
So I wouldn't be able to list all of them, but
locally,
just one
or two.
Locally, I know we do have Donegal Family Resource Center, we have Rafal Family Resource Center, and we also have Cara House as well, Family Resource Center. Those would be the main ones. And then sometimes you can also approach, your community center. How we can have, like, for instance, Kenny Community Center, right? They would be aware of activities that are also going around in the community as well. A good place that can signpost you to any health related problem is the public health website, which is the Health Service Executive, HSE.
HSE, yeah.
Right? So HSE is the website to go to understand anything around any health issue, to direct you as to where you need to go. So I always say part of health literacy is knowing what information to take. The most reliable information, the most reliable health information that you can consume in your area is your local national health website. And here in Ireland, it would be the HSE website.
HSE.
That's where you would have the most reliable information. That's where they would also list for you places you would need to go. So the HSE.
Okay, thank you very much. Can you explain what a stroke is in simple terms?
Okay, in a simple term, I would say you have blood vessels that are supplying blood to the brain, right?
I don't understand.
Blood vessel. So you have an artery that is supplying blood to the brain.
Okay.
And when there's a blockage, for some reason there's a blockage, so there's no blood supply beyond that blockage to that part of the brain. That's what a stroke is. So a stroke is you have blocked blood supply to a particular part of the brain.
Okay.
Yes. So when I try to explain on the videos, I have a video where I say, just imagine you have a plumbing system. And in that plumbing system, that that those pipes can get blocked for some reason. For instance, you have grease and all that stuff that can clog your pipe. And beyond the pipe, you have no flow. So in a similar way, things that we do in our lifestyle are going to clog the pipe. And when that pipe gets clogged, then you don't have further flow beyond that blockage. That area that does not get flow is now deprived of nutrients and oxygen and glucose and all that stuff. And then that is what is a stroke. So that's what a stroke is.
What are the most important warming signs people should know?
So there's the mnemonic that we talk about, and that's the B fast, which is BEFAST. So be fast, right?
Be fast. Okay.
Be fast. How to identify is when you have an acute onset, right? So you were fine 1 minute, and the next minute you now start to find that your balance has gone off, or you're starting to have, the E is for eye changes. So you have change in your vision. The vision, maybe you might feel as if it's a bit blurry, or you might feel as if part of, the field. So when, for instance, if you're looking at the time, you might see just this part of the field, but you can't see the other part of the field. Or some say, I feel like there's a curtain, there's a black spot in my eye, things like that. So you have eye changes, right? And it comes on just like that, right? So we said sudden onset of balance changes, eye changes, facial droop. When we talk about facial droop, it means one side of the face is slanted, right? So you might find maybe the cheek is dropping down, and people often say, I was drinking a cup of tea and then I just noticed it trickling down the corner of my mouth, so that's how they'll know that, okay, that could be a stroke. So that's the F of the B fast. So facial droop. And then the other one is following the F is arm weakness. I was drinking my cup of tea, or I tried to lift up my cup of tea and then I couldn't.
You can't say.
Or I was asleep and then I woke up one morning and I just felt like my arm was heavy. So that's arm weakness. But to go with the arm weakness, it can also be your leg as well, the leg weakness. So it's limb weakness. But for the mnemonic, to make it easier to remember, there's the A there for arm weakness. And then we have said balance, eye changes, facial droop, arm weakness, and then speech. Your speech is affected. So it gets a bit slurry. It could get a bit slurred where I'm talking. You can understand what I'm saying, but you can't really make out the sounds quite well.
It's not really articulated.
Not really articulating quite well. So it's slurred a bit, or you can understand what I'm saying. I can understand. I'm the one who's affected by the stroke, so I can understand what you're saying. So you're trying to talk to me. You're saying, can you hear me? And maybe I'm nodding. And then you're trying to get more information out of me, and all I can do is nod, and I can't say it out. So, or sometimes you're talking and I can't even understand what you're saying. But the S is now for speech changes. So either it gets a bit slurred, or I can't really talk at all, because I can hear you, but I can't say it out now. I can't express what I'm trying to say. And then the last thing is time. That's T. T for time. And what we're just basically trying to say there is time is brain, meaning that for every minute that we're delaying intervention to stroke care, more brain cells are getting affected. So the intervention is that we need to get to the hospital as quickly as we can. And that is, remember we said that there could be a blockage, right? So there's different types of stroke, but if it is the one where there is an actual blockage, then that something can be done regarding, trying to open up that blockage. And the earlier you get to the hospital, the quicker that can be sorted out and the less harm that can happen to the brain.
What lifestyle changes can reduce the risk of stroke?
So the lifestyle changes, the number one risk factor is high blood pressure. So about majority of the of the strokes that we see, majority of the patients have high blood pressure to about 80%, right? So high blood pressure is the number one risk factor. And that's the number one risk factor that is sort of easily accessible, should I say, that we don't necessarily have to go into a primary medical center. You can get a blood pressure machine in the pharmacy. You can get your blood pressure checked as well in the pharmacy. So that's one thing that we all sort of need to know, what our blood pressure is looking like. So blood pressure is the main one. And then following that, then we now have things like diabetes. Then we now
Sorry, you said the best one is 80 or
the best blood pressure machine.
Yeah.
You mean? Oh no, there's different types of blood pressure machines.
No, not the type of machine. Like when you measure it, what is the
target blood? The ideal blood pressure should be less than 140 over 80.
Okay.
Yeah, 140 over 80.
Over 80.
But that again is different depending on the risk factors that you have. So that number can change depending on the individual. So this is just a general number that whenever you get checked, we want the blood pressure to be less than 140 over 80. But if you do have certain conditions, then your doctor will advise differently. So that target now shifts, and that's where you need to then get the medical advice.
How does mental health link with the risk of or recovery from stroke?
The mental health challenges that someone might experience after a stroke, and I'd mentioned that immediately after it would be trying to adjust to the new you. Right. And you might have someone who probably is now physically impaired, or the speech has been affected. So it's just trying to adjust to that, to anxiety around, will I ever get better? Anxiety around fear, around death, fear around complications that someone may develop after stroke, fear of having another stroke.
Yeah.
So that also just brings, anxiety around, around yourself, and then also depression.
Depression,
right? Yeah. So those are the main, mental health challenges that someone may experience after a stroke, and that affects your rehab capacity. Sometimes if you're down and out, and then you don't have the energy or the will to continue to go on with rehab. So very much aware too, if someone has sustained a stroke, it's important for, I talk about especially stroke back home, that sometimes we don't have the actual services that can be able to give rehabilitation to people. So sometimes all we have is the caregiver, who is usually the family. Right, the family is the support system. The family is the nurse. The family is the pharmacist. The family is the rehab team for that patient. In a similar way, the family also has to be aware of the mental health challenges that can affect someone's potential to recovery. So those would be the main three mental health challenges.
And what can communities do to raise better awareness about stroke?
Yeah, so it starts by staying informed about what stroke is. And, I will even start it with myself and say, I think it's just a call out to health professionals to talk about stroke a bit more, because it is on the rise in Africa a lot. It continues to be a leading cause of death and disability globally. Right. So a call is to talk about it a bit more from a health professional's point of view and educate people around stroke. And that's what I've decided to do. And a story around that would be, even when I came here and I joined the hospital as a medical registrar, and I was then approached by one of the physicians there in hospital to join their team. And my first instance was to say, I said, no, I can't. And why? Well, it was simply because I was not confident enough to be part of a stroke team and to be part of the leader of that stroke team as well, right? And why? Because we do not have enough stroke training back home. And then it hit me when I went to think about it. And good thing he said, okay, no, go home and think about it. But just to remind you that is the point. The point is for you to learn about stroke.
About stroke, yeah. And
I think that was the life-changing moment for me. I then went home and sat down and I said, wow, think about that I've been given this opportunity, but I was so quick to possibly drop it because of a fear, because I do not know. But think about now the community itself. If I have been working for so long and I feel that I'm not quite enough I'm not the one to be going into this team, then who is going to talk about stroke in the community? Who is then going to be equipped about stroke? So that was now a challenge for me. I said, look, you know what? Okay, let me go, let me learn. And that is what gave me the purpose and the reason why I now want to talk about stroke a bit more generally.
And then we're going to talk about your platform, the Telehealth Chats.
The Telehealth Chats,
yeah.
Yes.
What is it exactly?
So the Telehealth Chats are access to health literacy information.
Okay.
I am opening up sessions where people can book online, and if they have a particular topic that they want to talk about and want to gain clarity about, then I am here for that.
Is this for free?
Yes.
Okay.
Yes. It is for free. So it's open up.
It's for free.
So it is for free. It is open up on certain days.
Okay.
So you would need to be on the website to see when, when those sessions are open up. But it's just to help people gain understanding around their health. It is not a medical consultation. That I will highlight.
Okay.
It is not a medical consultation. It's not going to be personalized advice around your health, but it is going to be, for instance, if you say I want to talk about diabetes, I will be giving you tips around understanding diabetes better and managing diabetes. Or, for instance, which is what I'm really enjoying about technology, it's helping us to bridge the knowledge gap. Irregardless of where you are in the world, you can access me, right? And we can talk about it. So you could maybe, you're here and you have a relative back home and they've been told that they have a stroke, but you do not know how to help them. You can ask that relative to join a group chat with yourself and myself, and we can talk. And I also have affordable and free as well, downloadable guides to help you manage different conditions that are available on my websites as well. So so the free health chats, that's what the chat is about. It's a health literacy chat that will help you gain understanding for yourself or understanding for a close family member or a friend, and you are the one who wants to be the one to give them that reliable health information to give them the confidence they need to carry on.
Who can benefit the most from this church?
Vulnerable groups of people. And when I talk about vulnerable groups of people, I talk about probably people from ethnic minorities. I talk about people that can usually be stigmatized. And people that are probably sometimes shy to approach a health service, right? And they just need a question answered, because not every interaction that you want to have with a health professional is going to be a medical consultation. Sometimes it's just that signposting that I was talking about, right? So sometimes you just want to know, where do I go for this? It's simple as that, but you don't know who to talk to. You don't know, you're fearful of, talking to people. So it's for that person. It's for that person who feels, I am fearful of interacting with that health person. I am that go-to person. My goal is to give people trust in healthcare workers, right? We want to demystify the stigma around negative talk around health workers, right? I want to give you the initiation and the motivation to seek help, right? So that's who the chats are for.
That's actually interesting. I'm gonna have my chat later.
Please do schedule. Please do schedule.
So, what kinds of questions people usually bring to you?
Yes. So the questions that mostly come out to me are around mental health. It's around, do I have the enough symptoms to seek care? Most questions are, I feel I do not even know what's wrong with me. And I say, that's okay. That is the point. That's why they are healthcare professionals. They're there to help you. So most questions are around mental health. Most questions also are around understanding medications, right? So many people will say, I have this prescription. The doctor has changed the medication, but I'm not understanding why the change.
Why?
And how does this medication work differently compared to that medication? Things like that. So it's always related to medication, understanding just medication better. understanding where to go around mental health. And signposting around mental health, where do I need to go? Those are the main two topics. Stroke as well is the other one. So not necessarily will they themselves be affected, but people who have had strokes, they know people that are affected by stroke, and they want to give them enough information around how to prevent another stroke, or how to just go through with rehabilitation, especially in settings that do not have rehabilitation or access to rehabilitation facilities. So those are the main.
How do your church help people feel more confident when meeting their doctor?
So it's about gaining. The chats help you to gain. They give you good information. And good information that's easily understood. And once you understand that information, then you're now able to communicate better with your healthcare provider. So I sort of guide you and say, look, these are the questions ideally that you would need to write down. Make sure. So I help you prepare for your consultation. So prepare. Sometimes when you're in a consultation, nerves take over. You forget what you wanted to say. So I always give people just the reminders that go in and have things written down. Always go in with your medication list. For instance, now, if you're someone who has recently relocated as well, if you do have any paperwork from back home, or if you have any boxes of your medication, go in. That's all going to help bring your story together. So go in prepared. If you have any numbers that you have been recording at home, write them down in a diary. When I talk about numbers, I'm talking about your blood pressure numbers. Maybe you're diabetic and you're taking your blood sugar readings. All that information is very crucial to make that consultation fruitful. So I just give you tips to help you prepare for your consultation.
Can you share an example where a church empowered someone to make better decisions about their health?
Their health. So that was a chat, that was a referral actually, and this is a referral for someone back home in Zimbabwe. And I think the main thing is people always, when I start to talk to them, the first thing that people always say is, oh, I really apologize for, and I always try to highlight, that just goes to show that people really are fearful of interacting with the medical doctor. Sometimes they always feel like they are being a bother, so my role and purpose is just to make people very comfortable about discussing whatever it is that they want to discuss with their doctor. So that was a good referral. Someone had just referred them to me, and I don't know them. And they had wanted to discuss, they wanted to discuss and see whether it's important for them to go in to see the doctor. And it was a pregnant lady, right, back home in Zimbabwe. And, she just described, oh, this is what I'm experiencing, 1, 2, 3. Should I be worried or not about it? And I said, look, we discussed through and went through why it's quite important for her to go in. And I motivated her to go in. Again, it's, highlighting to people that this is very serious. It's highlighting to people that you need to overcome, even if it is the fear, you need to overcome that fear, because it's important for you. It's important for you and baby. So it's giving people just that confidence to say, okay, let me go in and see the doctor, because sometimes people are quite fearful.
So how can people book a session?
So a session. So from my website, that's All In for Health Doctor. So all in the number 4 healthdr.com. So all in for healthdr.com.
Okay.
So allinforhealthdoctor.com. That's the website. And on the website, you will find on one of the pages there's a page that has a telehealth option, right? And it says schedule your telehealth option. So you'll click on that link.
Okay.
Ideally, you can also send an email on info@allinforhealthdoctor.com. That's where you can get me through email to schedule the chat. And on the social media pages as well, I am available on Instagram as All In for Health Doctor with the DR at the end, All In for Health Doctor. That's on Instagram. On Facebook, All In for Health. So you'll find the links to schedule the free health chat there. On YouTube as well. I have a YouTube channel that also has the links to the telehealth chats and the digital products that I also have. And that's Stroke and Mental Health Network. That's on YouTube.
Okay. So all the links are gonna be in the descriptions of this video. So if you are interested, you can just click in one of these link, and then you will reach the doctor. We're gonna talk about migrant community and health. Yeah. What unique health challenges do migrants face in your experience?
So in my experience, and in different countries as well. I myself have been a migrant. I am a migrant. And I have been one from the tender age of 16, right? From the tender age of 16, I traveled as a student and I went to Australia, right? And there I went as a teenager. So I was able to face the health system as a teenager, as a migrant, right? So those were very challenging situations. As a teen, you're naturally just going to be very shy and not wanting to interact with the health system. So those are the challenges that someone might initially experience, that you just do not know where to start. Yeah. So you do not know where to start. And this is where we're saying that the best place to start is usually the HSE website. The best place to start in the community is also a walk-in to your family resource center, and that they will be able to help you navigate and see what resource you need and how to go about that process. And the good thing is that experience made me realize that even as a young teenager, they do have adolescent-friendly services, right? So an encouragement to even the young migrant children that you do have youth tailored services that are appropriate for you, that know the challenges that you face, that will be able to address your challenges, that do not have stigma, around the services that they're offering you. So that's the first thing. And then the other challenges that I would have faced as well, but it wasn't a challenge, I think I talked about it earlier, is initially I was very fearful of interacting now as a mother when I was now in South Africa, and I needed contraceptive services, and I was quite fearful of interacting with the health services. And I think, as I talked about, how we're consuming a lot of information on social media that might make you make certain decisions, negative health decisions around your health, because you're fearful. You're consuming a lot of fearful facts and not facts, fearful information. And you make it to be a fact, and it's not necessarily a fact. So I think, make a choice in life, what to consume and what to not consume. There's a lot of information on social media. You can decide to consume information that's going to be productive for you, or you're going to decide to continue consuming information that's going to just build on fear. Fear, and that's just going to drive anxiety. That's just going to drive a lot more things. And that's not necessarily the real thing. Interact with the actual services and have your own experience with those services, right? So that's the main thing that I would talk about and want to highlight to migrants is interact with the actual services. And sometimes you might not necessarily always have to listen to what's being said on social media. And then I think those would be the main challenges, that sometimes we have hindrances that are self-built. We build our own hurdles and we build our own barriers sometimes because of what we've seen and what we've heard, but we actually have not interacted with the actual service. So I would just encourage people to actually interact with their own services. Like I said, that website would be HSE, and then with the resource centers, community would be the community resource centers. They will be able to signpost you. So migrants face challenges around just that false information and self-built barriers, but also not knowing where to go. And I've mentioned where you can actually go. I think those would be the main things. And I also spoke about literacy as well. We're coming from different backgrounds with different literacy levels as well. But they do have services that will cater to and be aware of the challenges that you are coming from. Right? And some are also coming from situations where they might experience post-traumatic stress disorders. Again, they are counseling services as well that are available for you. So just to be aware, I think those would be the main key topics that I'd want to talk about to the migrants, that there are services that are there for mental health, right? So if you do need mental health services, get in touch with your family resource center. If you just want to just understand the overall health picture of the country, go to the HSE website.
HSE, yes,
it'll give you an overall understanding of how to navigate your health, right? And then to the youth, I would say just look out and see. Again, the Family Resource Center will be able to direct you to youth-based services. And to the women regarding contraception and family planning, again, they will direct you to women-based centers that can be able to help you deal with, issues around family planning and contraception that you might need immediately as a migrant.
So what advice would you give to people to access this information? Because I think the main problem is people, they don't go to the information.
Yeah, so like I said, I think the wheel has to come from ourselves.
Health
that's what literacy has to come from ourselves. The will to be a healthy person in life has to come from ourselves. The will to continue carrying on and to continue making efforts. Because health is not just going to be something that's just going to be static. It's an ongoing daily basis. And sometimes it does take a toll, but we need to continue trying to make those efforts. So I think people just need to continuously be encouraged to make that effort, take that step and go in and seek information. With information, you're going to have good understanding to get better control of your health. Yes, at some point, all of us, yes, we are going to die, but the goal is to live a healthy life and enjoy your body and your life before that time comes. So take that step, go out, go to the resource centers so that you get well equipped, go through the HSE website so that you get well equipped to make better decisions about your health.
What keeps you personally motivated to keep promoting health?
My motivation is, I think, just trying to continuously make my parents proud, even them, despite them not being presently here on earth with us, just wanting to make them happy. That is what keeps me going. And then just wanting to make a greater impact for people and realizing that if not me, then who? There's that statement that says, be the change that you wish to see. So sometimes you're there, you're seeing something that you didn't like. And then you say, I'm going to make sure that I do something to change that. So that's just me. That's what keeps me going. I think there's a lot more that should be done. Like around stroke, as I was talking about, like around mental health, there's a lot of work that has to be done. And sometimes we say, oh, they should do this, they should do this. Who's they? Should do this,
Who's they? It can be you also.
You can be the they, right? So that realization that be the change that you want to be, that you want to see, rather. Be the change that you want to see. And that's what keeps me going. There's a lot of work to be done. And I think it's the work, it's the experience that problems, like I said earlier, that I keep seeing the same stories, the same presentations coming related to the same sort of lifestyles. So it's trying to deal with that, but on a larger scale. And that's what keeps me going, that there is still a realization to me that there's a lot of work to be done. And if not me, then who? So I can start, and then I'm sure as time goes, I will get people to help me to continue that.
We are closer to the end of this podcast. Is there anything that you would like to share with us that we didn't talk about?
I think we've managed to talk about most of the things. I think just to highlight one more thing that I think we did say that health is it's overly about your physical health, it's about your mental health, but also it's about your social health. And I think that's what I just wanted to highlight, that just to remind people that social connections are very much crucial for your well-being. Do not isolate yourself. And I think that's what we sometimes do as migrants as well. We are very much lean towards just really isolating, and that affects our mental health, that affects our physical health. So this is just a call to everyone in general, regardless of color, regardless of background as well, that we just need to continuously make efforts around connecting with each other.
Mm.
That really does improve our mental health. That reduces our risk of mental disorders. So I encourage people to always make an effort around social connections.
Yeah. So final word?
Final word would be health is not a static thing. It's a dynamic thing. It's something that we have to actively make an effort towards achieving. I urge everyone to constantly make an effort to improve their health literacy. I urge them to constantly make an effort to improve their daily lifestyle habits of exercising and eating. And I urge everyone to continuously socially connect. Those would be my last words. Yeah.
Okay. How can people find you? Would you like to remind us again?
So to find me, you would find me on Instagram. It's All In For Health Doctor, which is DR at the end. All In For Health Doctor. On Facebook, it's All In For Health. On TikTok, All In For Health Doctor. On YouTube, it's Stroke and Mental Health Network.
All right.
And website, www.allinforhealthdoctor.com.
www.allinfordoctor. allinforhealthdoctor.com. www.allinforhealthdoctor.com.
Yeah.
Thank you very much.
Thank you. And thank you for inviting me. It was an honor to be able to speak about something that I'm passionate about.
Yeah.
Thank you for giving me the platform.
You're very welcome. And thank you guys for listening to us. And I'll see you in the next episode.